My name is Danielle Ryan. I am from Lexington, North Carolina, and it's more of a small town feeling, but it's pretty close to the city of Winston-Salem.
Cool.
During undergrad, I worked at a community free clinic in Concord that served the indigent population, and I volunteered in their pharmacy. And at that point, I realized that pharmacy was a profession that I wanted to pursue. After that, I worked at an independent pharmacy, and then now I currently work at a hospital pharmacy in Winston. I actually received a scholarship, an AmeriCorps service scholarship, and so we had to complete 500 hours, and I completed it at the community pharmacy.
Wow.
Pharmacy, I feel like it offers people a chance to interact with patients and help them improve their quality of life. So it gives us a chance to really be hands-on with patients and improve their disease states and make interventions and offer guidance for them. So I was accepted to 2 different pharmacy schools, and I chose Wingate because they emphasize teamwork. And now that I am a student here at Wingate, I do realize that professors really want you to get to know your classmates. Pharmacy is a small profession that it really matters who you know, and you don't want to burn any bridges. So here they emphasize teamwork and team projects, and that was something that sold me immediately. They also said that they try to prepare their students for more of a clinical aspect of pharmacy rather than research. So that was another component in pharmacy school that I was looking for. I wanted to do something more clinical, something hands-on, because that's my personality type.
Sure.
And so Wingate offered that as well. So as a P3 student, I feel that I am ready to go out on my P4 rotations. One thing that Wingate offers that I know a lot of other schools do not offer is the fact that we get exposure to the community setting our P1 year, hospital setting our P2 year, and then during our 3rd year we have 5-week rotations at an inpatient setting and an ambulatory care site. So we have exposures to pretty much every aspect of pharmacy before we go out in P4 year. Where I work right now at Baptist Hospital, I had one of the pharmacists actually come up to me and compliment a Wingate student, and they said that he was the best student that he has ever had on rotation, and he will only take Wingate students now.
Wow.
So he said that he went above and beyond his expectations, and he actually wrote him a letter of recommendation for a residency. We also have our problem-based learning course, where there are about 6 or 7 of us in a group. We work up a patient case, we make any therapeutic decisions necessary for that patient, and it provides us with a way to see what goes on in an inpatient setting or an ambulatory care setting. So I just feel that I'm ready to go out and practice pharmacy. So after graduation, I want to pursue a residency. Right now, I'm leaning towards maybe VA, hospital, something more ambulatory care focused, but it could all change during my 4th year, depending on what exposure I get to see. For anyone that wants to pursue pharmacy as a profession, I would offer the advice of either working in a community pharmacy or volunteering with a pharmacist, either at a community pharmacy or in the hospital setting, to make sure that it's something that you like. I also would recommend you researching schools around you to see if there's a school that fits your personality. For me, that was one of the most important things. I wanted to be at an institution that really molded well with my personality and that would accept me.
Great.